The closing down of state-operated psychiatric beds began in the mid-1900s, a trend known as deinstitutionalization. It was fueled by the advent of modern psychiatric drugs and policies driven by the ideal that patients would be better off in a small community setting rather than in a larger facility.
The number of inpatient psychiatric beds in state hospitals has continued to decline, which is the same we've seen really since, the 1950s.
Elizabeth Sinclair Hank is co-author of a study called Going, Gone, Trends and Consequences of Eliminating State Psychiatric Beds, 2016. Since then, she says it's only gotten worse, partly because of COVID-19.
Many states utilize their psychiatric inpatient capacity for COVID-19 surge capacity planning, and so transferred those over to, for COVID patients, and then really never brought those back online.
We asked the State Department of Health and Human Services for their psychiatric bed numbers. In 2020, it was 916, down from the past few years. That's less than 9 beds per 100,000 population, fewer than most other states, and well below the Treatment Advocacy Center's recommended target of 50 per 100,000 population. When there are that few beds available for a population where there's a certain percentage of people who are going to experience severe mental illness, what becomes the end result? What happens in the community?
And what happens is that the care for people with severe mental illness falls to the systems that can't say no. So that's our nation's emergency departments, and then our jails and prisons.
Carteret County Sheriff Asa Buck agrees with mental health advocates who say prisons and jails are the new asylums.
That's absolutely true.
Sheriff Buck can't speak about Dylan Little's case, which is still pending in court. But he says the shift away from psychiatric hospitals to community-based treatment has placed a huge burden on law enforcement.
When you have people who are continually needing these services, and they go in, they come out. They go in, they come out. And there's no aftercare, follow-up, ordering somebody to do something.
Dylan Little's mother believes that's what happened to her son, who was in and out of psychiatric care.
If he had got the follow-up of treatment, stayed in the program, went to therapy, this might not have happened.
Dylan Little has been locked up in the Carteret County Jail more than 3 months now. He was ordered to undergo a mental health evaluation and is awaiting trial. Experts say his case is not uncommon, estimating that 1 in every 5 jail inmates today is mentally ill. We asked the Department of Health and Human Services what it's doing to help keep the mentally ill off the street and out of jails. In an email, a spokesperson says the state is dedicated to improving outcomes for individuals with behavioral health needs in the criminal justice system by increasing the number of programs for early identification and diversion away from the justice system. That includes crisis intervention team training for law enforcement, post-arrest diversion programs, and improving care during incarceration. But Sheriff Buck says, well, all of that might help. If people can't get consistent care, there will always be a mental health crisis, and it's officers who will have to respond.
We are the ones that get called, and we're the ones that need to be called, and we're the ones that need to continue to be called, because sometimes people are dealing with crisis so bad that they're going to act out and do things that are dangerous to people.